Is Dr. Epstein with a patient who is 1 day out from almost 1,200 FUE grafts. We take a look, Cindy. Basically, we stored all this frontal area. Now, he had had a prior procedure around 3 years earlier, around 1,000 grafts, so most of what you're seeing in the front is transplants. We just reinforced it. We did a relatively small one last time, somewhat small this time, and you can see the donor area, or you can't even see anything because he's literally 1 day out from surgery, and he's basically all healed up. This is when you use a 0.85 millimeter punch combined with the WAW system, which is an oscillating system for harvesting the grafts. But this basically is 1 day post-op from 1,100 and almost 1,200 grafts from there. And then up front, you can see what he looks like 1 day out. You can see all the little tiny crusts where his hairs were placed. Within really 4 or 5 days, he should be presentable. Any comments?
Yes, I did the procedure 3 years ago, and it is night and day between the pain, the reduction in terms of obviously what is there in terms of the crust. Just completely comfortable also at night. I completely feel wonderful that I came to him the second time. It's just a reinforcement more than anything because it didn't look terrible, but obviously I could tell that certain spots were needing it. And again, I fully trust this man. Thank you.
So anyway, things that we're doing differently than 3 years ago is mainly we're using smaller punches because as the technology has improved, we're able to use these smaller punches, these oscillating hybrid punches, and that reduces the inflammation. The grafts are also a bit smaller, so therefore less trauma when we're placing the grafts. And just the way my whole office does these procedures, everything is just, FUE is basically our bread and butter, so we have a much more refined, up just process. Anyway, this is Dr. Epstein. Thank you so much.
Can I say one more thing?
Yes.
The staff, everyone was incredible. From the moment you come in, even the calls beforehand, everything, top notch. Can't say enough about the staff because they're just as important as he is. So.
Thank you.
Yeah. Anyway, yes, thank you. Thanks, Steph. Anyway, it's Dr. Epstein. Thank you very much. Patient 1 day out from surgery.
Awesome. Thank you.